Thank you very much, Mr. Speaker. I'm very pleased for several reasons to take part in this debate. The motion before us involves an issue of particular importance since it concerns the fate of Canadian Forces veterans and former members of the RCMP. This motion provides us with the opportunity to discuss a subject that our government takes very seriously. It also allows us to illustrate the measures already in place that ensure the well-being of those brave men and women who wear a uniform. By tabling this motion, the member is implying that our government has been neglecting our responsibilities with respect to our veterans and their families. Mr. Speaker, nothing is further from the truth. Mr. Speaker, many other members of our government have talked about the wide array of programs and supports available to veterans and how we continue to increase spending in this area. But so far, no one has touched on the issue of mental health support. I would like to focus my remarks on the topic as I feel it's the area which we have provided exceptional programs and services to Canada's veterans. Veterans Affairs Canada, in collaboration with the Department of National Defence, has created a network of 17 mental health clinics across the country to offer specialized services to veterans and Canadian Forces and RCMP members suffering from operational stress injuries caused by their service. There are currently 10 such clinics administered by Veterans Affairs Canada. 9 are outpatient clinics located in Fredericton, Quebec, Montreal, Ottawa, London, Winnipeg, Calgary, Edmonton, and Vancouver. The 10th is the residential treatment clinic for operational stress injuries at St. Anne. Mr. Speaker, let me take a moment and talk about how these operational stress injury clinics work. While continuing to live in their community, veterans attend appointments at the OSI clinics. They are offered a clinical assessment and a variety of treatment options, including individual therapies, group sessions, psychoeducation sessions, and other resources. The clinics' teams are made up of psychiatrists, psychologists, social workers, mental health nurses, and other specialized clinicians who understand the experience and needs of veterans. Loved ones can be involved in the treatment, and eligible family members can also receive services. Treatment approaches in OSI clinics are based on best practices and are tailored to meet each client's needs. The team works closely with other healthcare or community organizations to ensure appropriate follow-up as needed. A referral to other centers may be part of the treatment process depending on the needs of the client. When there are difficulties with addiction or substance abuse, these centers provide specialized treatment. Telehealth services help ensure that veterans are provided with easier access to emotional support when they need it. Coast-to-coast support is available to help these brave men and women overcome challenges of complex mental health injuries. I know the Canadian Forces offer similar supports as well through their 7 operational trauma and stress support centers. These new services significantly enhance the country's support so veterans and their families living with mental health conditions. Today, there are more services and programs available, more services available than ever before to support them. There are also more frontline health specialists than ever before to ensure that support is effective. Integrated support centers located on 24 bases and wing give staff from Veterans Affairs Canada and D&D the opportunity to offer early intervention and support. Working side by side, the frontline employees from Veterans Affairs Canada and D&D develop personalized case plan for each individual veteran to support their re-establishment in civilian life. The two organizations have also created a very successful peer support network called the Operational Stress Injury Support Program. Specially trained peer support coordinators who have first-hand experience with operational stress injuries and the loss of loved ones provide vital personal support to Canadian Forces members, veterans, and their families. For those in distress, assistance is available 24 hours a day, 7 days a week through the VAC Assistance Service Line. Veterans and their families can access counseling and referral services, including support for mental and emotional health concerns. In addition, more than 4,000 community mental health providers are registered to provide care and support and professional counseling services in veterans' local communities. There are over 200 clinical care managers registered across the country who are dedicated to providing intensive support daily, if required, to veterans with complex needs. I don't know how much time I have, Mr. Speaker.
About 4 minutes are remaining in his speech.
There are health professionals such as occupational therapists and mental health nurses who build strong support relationship with the veterans and the family to help them follow through on their case treatment plans, help them link to community resources they may need, and contact them with health professionals who can help them and their family with recovery. Mr. Speaker, nearly 15,000 veterans suffering from mental health problems receive some form of assistance or support from the department. Our government takes it very seriously, and I want to assure our veterans, all members of this chamber, that we are fully aware of the importance of the terms of our responsibility in this regard. We are not neglecting our duty to these brave men and women. Their dedication to this country is a constant reminder that our government, in turn, must serve them with equal devotion. Thank you, Mr. Speaker.
Questions and comments. L'honorable député de Beauport-Limoilou.
Merci, Monsieur le Président. Écoutez, Monsieur le Président, on va regarder la situation telle qu'elle est. Ce gouvernement a multiplié les mesures fiscales coûteuses à coût de dizaines de millions, une centaine de millions, ça fait des milliards, et on ne parle pas des coupures de TPS et des coupures d'impôts aux grandes entreprises. Le total se chiffre à plusieurs dizaines de milliards par année d'argent des contribuables gaspillés, ce qui permet à ce gouvernement de créer crise artificielle sur crise artificielle. Actuellement, le traitement des anciens combattants est une crise artificiellement créée par ce gouvernement. Alors, ce que je voudrais savoir de la part de mon collègue, écoutez, la moindre des choses, considérant la situation dans le retard des traitements des dossiers des anciens combattants, considérant toutes les insuffisances du système actuel, ne défendrait-il pas avec nous au moins le maintien au minimum du budget, sinon même envisager de l'augmenter, mais au moins le minimum de soutenir le budget actuel pour éviter des coupures?
The honourable member for Mississauga East, Cooksville.
Mr. Speaker, I would like to thank the honourable member for his question. Well, and I would like to repeat what was said in this House many times before, that there will be no cuts to services provided to veterans. This government has been increasing services for veterans and the quality of services. And maybe the honourable member remembers that the greatest costs to services for veterans occurred in 1995 by the previous government. Some of those services were fully restored, some are being restored by this government. Is being dedicated to providing services to veterans and enhancing the services, and this is what we are doing now.
Question et commentaire. The honourable member for Charlottetown.
Thank you, Mr. Speaker, and I thank my colleague, who is also a member of the Veterans Affairs Committee, for his remarks and for his interest on the mental health of veterans. He rightly pointed out that there are 17 occupational stress injury clinics across the country. And my question for the honourable member is this: should we be satisfied with that? Is that enough? Is the problem of mental health within our veterans community fully and adequately served at that level? Thank you.
The honourable member for Mississauga East, Cooksville.
Mr. Speaker, I would like to thank my colleague, the honourable member, for his question. And the answer is very simple. whether there is a room for improvement, there is always room for improvement. And I think Minister of Veterans Affairs stated many, many times that our goal of this government is to improve services for veterans. Of course, there is a room for improvement, and we're working to improve services, to provide more services, to keep providing more and better services to our great men and women in uniform who serve this country.
Questions et commentaires? L'honorable ministre des Anciens combattants.
Merci beaucoup, Monsieur le Président, et je veux féliciter mon collègue de Mississauga d'East Cooksville, d'origine polonaise, pour son excellent discours et pour avoir souligné à quel point il est important de venir en aide à nos vétérans qui éprouvent des problèmes de santé mentale. C'est la raison pour laquelle nous avons nos 17 cliniques et près de 15 000 vétérans et des membres de leur famille qui en bénéficient. Mais comme le dit le membre, nous devons continuer. Et ma question pour le membre, c'est concernant, est-ce que les vétérans dans son comté lui ont demandé si on devait continuer justement à améliorer nos services et notamment à réduire la paperasse, à faire en sorte qu'on arrête d'étouffer nos vétérans dans la paperasse, dans la bureaucratie qui fait en sorte que ça étire les délais, que ça alourdit les procédures. Alors ma question, est-ce que mon collègue, le député, a eu des demandes de vétérans dans son comté pour que l'on réduise la paperasse et que l'on continue à couper dans la bureaucratie pour faire en sorte qu'on donne de meilleurs services? Et est-ce que, je veux le remercier aussi pour avoir appuyé nos programmes comme du régiment au bâtiment, avoir appuyé les améliorations à la nouvelle charte. Malheureusement, les néo-démocrates, on n'a pas pu compter sur leur appui, mais je veux remercier le député qui a appuyé nos vétérans. Merci.
The honourable member for Mississauga East Cooksville.
Mr. Speaker, I would like to thank the honourable member for his excellent question. Of course, I am in touch with the veterans in my riding, and all veterans are looking for services that are simplified. And cutting red tape is very important. Many people, many veterans are really confused with some paperwork they have to fill out. Therefore, they're looking for us to cut the red tape, to simplify the procedures, that they can access their benefits the faster way, and that they won't have to spend a lot of time on bureaucracy, but enhancement of these services is required. Thank you, Mr. Speaker.